सर गुड आफ्टरनून। 2:30 को शुरू करते हैं, जो स्टूडेंट्स आने बाकी है। गुड आफ्टरनून सर।
हाँ मैडम, वो शेयर स्क्रीन कैसे करने का इसमें? हाँ 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 हाँ, फिर उसमें एंटायर विंडो एंड एंटायर स्क्रीन एंड विंडो। हाँ तो पीपीटी है ना, तो वहां पे जाके एंटायर स्क्रीन करूं। हेलो, वो आता नहीं है क्योंकि मैंने गूगल कभी, हम लोग मोस्टली करते हैं तो इसमें ही करते हैं। हाँ उसमें ना देखो, मैं प्रेजेंट नाउ में गया। आपका मुझे दिखता नहीं है। एक मिनट। प्रेजेंट नाउ योर एंटायर स्क्रीन, हाँ अभी उसको मैं क्लिक करता हूँ ना, तो ऊपर आता है यू मस्ट गेट ग्रांट द परमिशन इन ऑर्डर टू स्क्रीन शेयर, कैन नॉट शेयर योर स्क्रीन अनलेस द परमिशन इज ग्रांट द परमिशन इन ऑर्डर टू स्क्रीन शेयर। present your entire screen abuse comment. Must grant permission in order to screen share. Cannot present your own entire screen abuse comment. इसमें लिखा हुआ है कि आप नहीं कर सकते. यहाँ पे लिखा है you must grant permission in order to screen share. नहीं, बहुत बड़ा है, बहुत बड़ा है. You must get the share the screen, cannot share the screen. You must grant permission. अभी वो permission कैसे लेने का? Means I have to give you permission. नहीं नहीं, यहाँ पे क्या लिखा है आप सुनिए. उसमें ये लिखा है कि cannot you and what about what you must get the share. You must grant the permission view. यानी इसमें तो ऐसा लगता है कि मुझे आपको परमिशन देना है. मैंने खुला भी रखा है मेरा जो प्रेजेंटेशन है ना, वो मेरा ओपन ही है. एक सेकंड ना. अभी आपको मुझे मेरा क्या दिख रहा है आपको? हाँ, पीपीटी है. प्रेजेंट नाउ अभी लिखा है प्रेजेंट नाउ. फिर योर एंटायर स्क्रीन आ गया. कैनॉट, इसमें क्या लिखा है? कैनॉट शेयर योर स्क्रीन. यू मस्ट ग्रांट परमिशन इन ऑर्डर टू शेयर स्क्रीन. हेमंत को बुला.
हेमंत भैया
हेमंत, ये किसके, ये किसने क्या डिसमिस किया? अभी मुझे मेरा ये प्रेजेंटेशन है ना, वो शेयर करना है. यहाँ पे
प्रेजेंट नाउ, तो प्रेजेंट नाउ,
प्रेजेंट नाउ ना.
हाँ,
अभी एंटायर स्क्रीन बोल रहे हैं और विंडो.
आपको कैसा करना है? प्रेजेंट है, स्क्रीन और विंडो. विंडो ही करेंगे तो आप बाकी भी ओपन रहेगा.
यू मस्ट ग्रांट परमिशन ऑर्डर टू शेयर द स्क्रीन. परमिशन किसने ब्लॉक किया है? शेयर आ गया।
सर आप अलग ब्राउजर से स्टार्ट करना चाहते हो? हेलो, हाँ सर। हाँ सर।
परमिशन पूछा लगता है शेयर कर।
परमिशन तो है मेरी तरफ। हेलो, हाँ सर। आप हेलो,
हाँ बोलो
सर आप अलग
Can you see
ब्राउजर
my
से कर रहे हो? अभी तक तो नहीं दिख रहा है।
शेयर मीन्स इधर से कुछ सिलेक्ट करना पड़ेगा ना।
नहीं, फर्स्ट शेयर करो,
शेयर करना पड़ेगा, तब तक थोड़ा वेलकम बोल देखना। हाँ, ओके ओके। हाँ
हेलो, कैन यू सी?
यस सर, वी विल सी। सर 1 मिनट थोड़ा सा आपका इंट्रोडक्शन दे देते हैं, बाद में आप स्टार्ट करिए, 1 आध मिनट लगेगा सिर्फ। तो गुड आफ्टरनून एवरीवन। एक तो स्वयं सुरक्षित रहे और दूसरों को भी सुरक्षित रखे। जन आंदोलन कोविड। हेलो सर, सुनाई दे रहा है?
कैन यू सी द स्क्रीन?
यस सर, यस। हेलो, हाँ सर, दिख रहा है आपका स्क्रीन दिख रहा है।
लेकिन मेरा आवाज नहीं आ रहा है, आपका भी आवाज मुझे नहीं सुन रहा है।
मेरी आवाज आपको नहीं आ रही है?
आपको मेरी आवाज आ रही है?
जस्ट मैं ना मोबाइल रखती हूँ। हाँ सर, बोलिए।
आवाज क्यों नहीं आ रही? माइक्रोफोन तो ऑन है। हेलो,
हाँ, आपकी आवाज इधर नहीं आ रही है सर।
आपका आवाज मुझे मिल रहा है।
मिल रहा है? मेरा आवाज आ रहा है?
हाँ, मेरा आपका आवाज आ रहा है, लेकिन आपका आवाज नहीं आ रहा है। 1 मिनट।
हाँ
1 मिनट। म्यूट कहाँ से आवाज है? नहीं, इधर हमने सेटिंग में किया नहीं होगा ना चालू शायद।
हाँ, सेटिंग में जाके माइक्रोफोन में।
सेटिंग्स इसमें सेटिंग्स में आके वॉल्यूम सेटिंग्स ऑडियो में तो टेस्ट कर दो।
हेलो,
हाँ सर, आपकी आवाज आ रही है।
अभी आ गई ना?
हाँ, आ गई आ गई।
ओके, सो विल स्टार्ट नाउ।
ओके सर, थैंक यू। मेरी आवाज आ रही है ना आपको? नो प्रॉब्लम।
हाँ, अभी आ रही है।
यस। तो गुड आफ्टरनून एवरीवन। स्वयं सुरक्षित रहे और दूसरों को भी सुरक्षित रखें। जन आंदोलन कोविड-19 अनलॉक विद प्रिकॉशन के इस तीसरे वेबिनार में आप सभी का मैं डॉक्टर सरिता पसीर दिल से स्वागत करती हूँ। हमारे आज के गेस्ट डॉक्टर रमेश शाह सर, डॉक्टर रुजुता दुबे मैम, ट्रस्टी एंड HOD ऑफ सीरो प्रसूति तंत्र डिपार्टमेंट, प्रिंसिपल डॉक्टर हेमलता शेंडे मैम, सभी टीचर्स और मेरे प्यारे विद्यार्थियों, ज्यादा टाइम नहीं लेते हुए हम वेबिनार की शुरुआत करते हैं। और शुरुआत के पहले मैं डॉक्टर धन्या मैम को रिक्वेस्ट करती हूँ कि सर का इंट्रोडक्शन दे देना, तुरंत हम स्टार्ट कर देंगे। धन्या मैम प्लीज।
Thank you, madam.
हाँ, यस।
Present with us today is Dr. Rajesh Shah. Dr. Rajesh Shah, he is a consulting ophthalmologist in Borivali. He has over 30 years of experience in the field. In the fight against corona, many drugs have been proposed in this current pandemic against COVID-19, from ACE inhibitors, ARBs, etc. So methylene blue is also one such drug. Methylene blue, it's a dye used in the treatment of, we all know about it, methemoglobinemia, and then many diagnostic procedures. So sir will be talking to us about the crusade against corona with methylene blue. Welcome, sir.
Thank you, madam, for the kind introduction. Can all of you hear me?
Yes, sir.
Okay.
Sir, yes.
Now, this concept was actually been very old, almost 130 years old. So I'll be going through the history, and as well as I'll tell you how the methylene blue is helping us. In fact, in Gujarat and Maharashtra, the number of cases has dropped down drastically, and I will definitely say that the methylene blue is the main source which has helped us to reduce the number of cases. We have no financial interest, all three of the speakers. We are not advocating or soliciting anything. We are just describing what we have learned and done during our research in our hospital and in our home, and for our close kins and friends and families. We are not giving any prescriptions, or we are not giving any advice also. All of you are requested to do your own research on Google and wherever you can, and ample evidence is available on the net. Let your mind, your conscience will be your best guide. I request all of you to listen about methylene blue without any prejudice. These are the three doctors. The first one is Dr. Kakadia from Bhavnagar. The middle one is Dr. Gulwankar, who is the main person who has done this research, and he's been using methylene blue for last 20 years in India, and myself. When you find anything which is new, as Gandhiji always says that, first they ignore you, then they laugh at you, then they fight with you, and then ultimately you always win. Indigo, the methylene blue, actually was started long back, and they were taking out this methylene blue dye in the form of indigo, which was from the vegetable source, but it was extremely expensive to extract methylene blue from the vegetable source. So Dr. Henry Caro in 1876 made the first synthetic indigo. But in UK and in European country, to produce this, even with the chemical things, has been very expensive. Dr. Albert Richer von, professor and head of the general surgery, University of Vienna, Austria, he invented the first aid kit in the world for the first time, inventor of iodine for war wound in disinfection. Now what we are using today, betadine, is byproduct of this iodine, and over a period of time, it has been safe and non-irritant, which was irritant in the past in the form of iodine. The prime pioneer of intramuscular injections of methylene blue. He used intravascular methylene blue in 1877. You can understand it is almost 140 years from now, for the treatment of osteosarcoma of the femur. He used 4 milligram, which is very high dose of intramuscular injections of methylene blue once a week for 8 weeks. And he treated 30 patients with nearly 100% cure rate. Dr. Paul Enrich from Germany. He was the first one to use IV and oral methylene blue for the treatment of malaria. First to find the cure of syphilis with methylene blue. First to make anti-diphtheria serum. He first demonstrated how to stain bacteria, fungi, and protozoa by using methylene blue. Zim Nielsen and ground staining was inspired from his work. He, he coined the names microbial chemotherapy and magic bullets, and he saved millions of lives. These are the two Nobel Prize winner in physiology or in medicine in 1908. Dr. Elin Ilich Mechnikov, the first detected the gamma globulin, innate and humoral immune system. This is our own scientist from India, Dr. N.L. Bordia, the first director of India's TB control program, first to use methylene blue in treatment of TB, Guruji of Dr. Gulwankar, who is actually a father of methylene blue in modern times. He is Dr. Gulwankar. He is a solo private practitioner in Bhavnagar. In practice for last 42 years, he treated over 10,000 patients of tuberculosis, has a great experience of treating many patients with swine flu with methylene blue since 2009 to 2014, has successfully treated 2,000 patients of COVID-19 with methylene blue by nebulizer and sublingual with zero mortality, with very minimum or nil post-COVID fibrosis. He has prevented at least 600 patients from going into ICU and ventilator stage, including a 93 years old age mother of a famous and a popular politician from Gujarat. These are the two doctors. This is myself. Now, this is one patient which we treated, the corneal ulcer. You see how bad the corneal ulcer has been. This has been treated with methylene blue. You see after 4 days, on the day 3, and on 7 day, the full corneal ulcer is cleared. If methylene blue was not there, probably the patient would have lost this eye. You can see from first to the end. Now let us understand, methylene blue is known as methyl thionylium chloride. It's a medication, actually it is a dye. As a medication, it is mainly used to treat the methemoglobinemia, which is a cyanide poisoning terminal stage. Methylene blue has 17 different indications, wonder molecule of 1.3 centuries. It is an antiviral and antibacterial. It is anti-Alzheimer, anti-Parkinson, anti-aging, and anti-cancer drug. Now, this was published on March 30, 2020, that is this year only, where 2,500 patients from France were treated with methylene blue for some cancers. And to the surprise, none of these patients developed COVID-19 infection. This is the history of methylene blue, success of methylene blue in Bhavnagar, Gujarat state. City has 6 lakh people. Rural area surrounding the city is 23 lakhs. So total there were 29 lakhs people in Bhavnagar district. 3,000 patients, 20,000 nursing staff, not a single doctor's death, no paramedical death. Only 50 doctors became COVID positive and only 5 to 6 needed ICU admission. Again, out of 29 lakhs of population, in the August they had 60 to 80 COVID patients per day, and in October that number of patients reduced to 18 to 20 per day. ICU beds are almost empty. The government was planning to convert 3 and 4-star hotels into COVID center has been cancelled. And the last day which I heard from him that there are only 11 cases in Bhavnagar district. So some of the success story which had been printed in various newspapers. One more. You must thank and congratulate this advocate, Sanjay Paranjpe. He has been practicing in Bhavnagar. He made 0.1% of methylene blue and distributed to thousands of bottles to all over Gujarat. He makes bottle at home from 6 p.m. Before and after the court hours, he and his friends team distribute methylene blue in rural area, and whenever he comes to know about the red zone, he distributes methylene blue free of charge. He is the highest time blood donor. This is the Government Medical College, Bhavnagar. This is another patient which is methemoglobin. You can see in the right hand side, there is a violet color tongue, which after giving the methylene blue has become pink, so that the oxygen saturation after giving the methylene blue has improved significantly from 84% to nearly 100%. This is another contribution by Dr. Sunil Garge from Indore, and he has treated large number of patients with methylene blue. Methylene blue has a potent antiviral activity against SARS-CoV-2 in absence of UV activation in vitro. This is another paper from Switzerland, Geneva, Switzerland, 14th of August 2022. Is another physician from Surat. He has treated more than 100 patients with IV methylene blue successfully. This is another physician from USA who has been extremely interested and treated large number of patients even in United States. No. History of Attila is in webinar. History of methylene blue. The chemical name is methyl thioninium chloride. It is a phenoazothionein dye and a very potent and equally safe medication. Chemical behavior is known as redox, reduction plus oxidation, a dual potential, means it can give electrons, that is reduction, or it can take away electrons, oxidation, depending upon the photochemical and enzymatic pathway involved. Methylene blue is the first fully synthetic man-made drug used in allopathy medicines. Its use in treatment of malaria was pioneered by Dr. Paul Ehrlich in 1881. History of methylene blue, Part 2. It was used IV, per oral and topical germicidal till 1940. Till sulfonamide and penicillin came in 1950. It was very powerful oxidant, electron giver, and microbes as well as protozoa and small parasites. Whereas for human cell membrane, it works as an antioxidant. So it does not damage the human cell wall. It enhances mitochondrial activity and respiration of mitochondria. It also increases the activity of sodium ATPase pathway. It reverses methemoglobinemia in 20 to 30 seconds, 20 to 30 minutes when given IV. This was the only drug which is very effective for cyanide and cyanide poisoning. This is another paper from British Medical Journal, University of Sao Paulo, Brazil. Methylene blue dye photodynamic therapy induces selective and massive cell death in a human breast cancer cells. This is another paper which is abstract from Cancer Research Journal from India, evaluating the therapeutic effect of methylene blue against the prostate cancer. It says that it destroys the cancer cells of the prostate in a significant way. This is another paper with methylene blue found to kill the malarial parasites in record time of 48 hours. WHO also has recognized methylene blue as an important drug. It has multiple use. It is the only drug which is antidote for cyanide as well as the nitrite poisoning. It is an antidote for organophosphorus poisoning also. It was only and primary line of treatment in malaria till chloroquine was seen from the methylene blue only. Even today, its primary line of treatment for idiopathic, toxic, or carbon monoxide poisoning induced methemoglobinemia. So any methemoglobinemia, which is also a part of COVID-19, can be treated with methylene blue. It has many different therapeutic uses. WHO has WHO has included in a modern list of most essential medicine ever since it is found. I will show you the circular of WHO dated 8th of May 2015. You can go on to net also and to find out exactly what is written there. This is the letter which has been issued by WHO. Now, if you see here, methylene blue is also it's 10 milligram per 10 ml. It's an essential drug of where every country, the member country, has to keep these injections available in their country, and you cannot levy any taxes on these essential drugs. So that important is methylene blue as a drug. This is another one where they have said that the amount of dose, that is 1 milligram per kg intravenously over a period of 5 to 30 minutes in either normal saline or preferably dextran. Dengue and chikungunya viruses in plasmas are effectively inactivated after the treatment of methylene blue and visible light. This is again from Australia. This is another one where methylene blue inactivates of plasma by methylene concentration of 1 micromolar is sufficient to inactivate HIV-1, 2, hepatitis C, Toga virus, West Nile virus, and Ebola virus. Again, from the Middle East, in 2018, they have published Ebola virus treatment with methylene blue. Now, remdesivir also was actually a treatment of Ebola. And since Ebola virus and the COVID-19 virus, the structure is almost the same, it is assumed that remdesivir is also effective against the Ebola COVID-19. Now, methylene blue works in, let us understand how and why. Now, if you see the chemical structure of the methylene blue, you see the methylene blue chloride, the chloroquine, quinine, and hydroxyquinone. They commonly share certain basic molecules in the structure. Now, if you see in this, if you see this common structure is there almost in all the things. That means the chloroquine is basically derived from methylene blue. This is another paper from Beijing, China, which they have conducted even in Bangladesh, and they have said that inactivation of SARS-CoV-2 virus in human plasma by methylene blue. This is the way they have calculated the dose to be given. I will explain to you later. Methylene blue photochemical treatment as a reliable SARS-CoV-2 plasma virus inactivation. This is again a paper from China, Wuhan, China. Now, methylene blue, multiple mechanism of actions. The first one is it is a virucidal. It kills the coronavirus, almost all other viruses and all microbes up to size of Malarian protozoa. In a few minutes, it kills in few minutes. It kills by oxidation, reduction, and by electron bombarding. It by removing the oxygen and hydrogen. So drug resistance to it, it is very unlikely to develop a drug resistance even if the virus changes its structure. The second mechanism is antiviral. It makes cellular cytoplasma and extracellular fluids into an alkaline media. So pH less than 7.2. So virus does not grow in an alkaline media. Novel coronavirus does not replicate in alkaline media. It needs acidic media less than 6.8. So it prevents viral growth in lower concentration. Chloroquine, hydroxyquinone, both are the same, are step derivatives of methylene blue, and they share like alkalizing property. Zinc also works on the same principle. The third action of methylene blue is it is the only chemical treatment of methemoglobinemia if given intravenously in the dose of 1 milligram per kg body weight. Methylene blue can reverse methemoglobinemia in 20 minutes. Coronavirus is hungry for ions. So once they are in the blood, They snatch away the iron molecule from normal hemoglobin. This leads to a condition which is similar to methemoglobinemia. This iron deficiency induces methemoglobinemia, giving rise to initial happy hypoxia and later severe hypoxia, leading to a ventilator and most cases to a point of no return. Methylene blue is the only antidote of cyanide poisoning, the deadliest of all the poisoning, WHO wicked, and also the best antidote of carbon monoxide poisoning, as well as hyphosamide, that is organophosphorus poisoning. The fourth mechanism of action is it is anti-cytokinin. Upon chemical contact, it is inactivate NLRS-RP3, inflammasome, IL-6, which is a very common thing, interleukin-6, TNF, a tumor necrosis factor alpha. It stops secretion of, most important is IL-1B, that is interleukin-1 beta, and IL-18. These 5 chemicals are produced by patients dying. Patients' white blood cells which are dying, cells which have been overwhelmed and overtaken by millions of coronavirus. These death proteins of WBC are known to cause cytokinase. And what we are talking about is the cytokinase storm is because of the dying number of WBC. Methylene blue very well prevents the cytokinase storms and hence can reverse lung pneumonia and tissue hypoxia. Methylene blue is also acting as an anticoagulant. It helps to prevent the intravascular coagulation by reducing thrombin, fibrinogen, and factor VIII. So lung alveolar capillary blockage is also cleared, which helps in clearing the pneumonia rapidly. Sixth mechanism, it prevents peripheral vasodilatation and hypotonic shock. In viral sepsis, 3 chemicals named bradykinin, nitric acid, and cGMP, that is cyclic guanosine monophosphate, are secreted. This hormone causes peripheral blood vessels to dilate, which causes reduction in the blood pressure below the critical level. As a result, kidney and liver receives very little blood, which leads the heart to slow down. It becomes a vicious cycle, ultimately leading to multi-organ failure and almost certain death. This condition is known as a hypoperfusion septicemic shock. Methylene blue inactivates as well as stops production of nitric acid and cyclic GMP, thus preventing and reversing the deadly shock. Now, this is the financial aspect of methylene blue. You can treat the patients in rupees 400 with methylene blue as compared to 1,50,000 rupees from all the above combination of drugs. Now, eighth mechanism is it prevents and to a good extent reverses the fibrosis of the lung. This is the most common thing which we find after treating the COVID-19. Many persons who have recovered from COVID pneumonia have now been found to develop a slow or a fast lung fibrosis. Interstitial lung fibrosis, if significant, leads to normal by oxygen concentration. Such patients are also highly prone to other secondary lung infections. Such persons are denied of US green card or permanent residency in most of the developed countries, especially Australia, New Zealand, Canada, and Germany. There is one case where the female has to take a divorce because she had a fibrosis of the lung. On the left hand side, what you see is the normal bronchus, and on this side, you see the hyaline which is deposited in a COVID-19 patients, narrowing the passage of the bronchus. This is the bronchoscope which is done by Dr. Golwankar. You can see the amount of damage and hyaline deposit narrowing the bronchus significantly. This is a COVID-19 lungs, patient with a COVID-19 lungs. This is from Dr. Deepak Gulwankar. You can see on the right hand side of the left, right, you see the amount of involvement of the lungs. And after treating with methylene blue, the lungs have become quite clear. This is another patient with left side of pneumonia. And then after treating with the methylene blue, you can see the complete clearance of the pneumonia with methylene blue. This is again bilateral pneumonic patches and completely clear with methylene blue, which is given in the form of nebulizer. In all last 3 patients, they have given a nebulizer. This is again the virus and complete destruction. This is extensive and extremely good work by Dr. Gulwankar. This is how the calculation of methylene blue either to be taken IV or to be taken orally. What you need is 3 minutes were needed to inactivate the viruses in the concentration of 5 micromole per liter. This is again the calculation which ultimately, if you do all these calculations, you need to have 0.1% orally and 10 milligram in 10 ml when you give in IV. Another doctor called Dr. Rakesh Kalathria from Surat. He has treated 76 patients with methylene IV blue. Moment he gets the patches in the lungs, he gives intravenous methylene blue in his clinic, makes the patient to stay for some time and send them back. He has treated 76 patients 100% successfully and no progression of the lung infiltration has occurred. First line of treatment on OPD basis, 10 ml of 100 milligram of methylene blue diluted with 100 ml of dextrose given over a period of 1 hour. Injection Dexona also was given after 2 hours. This is another patient, another doctor, Dr. Vishnu Patel, and his son, who is a chest physician, who has treated 200 patients with IV methylene blue. The nebulizer, remember, you have to understand it has to be given by nebulizer, not inhalation. When you do a nebulizer, the nebulizer breaks the molecule of water to 4 micron size, and that is the size of your smallest alveoli, the bronchiole. So this 4 micron can go to the extreme ends of the lungs. When you do the inhalation, the steam inhalation, it increases the temperature by 100. So only water will evaporate because the boiling point of methylene blue is 1200. So you cannot do steam inhalation with methylene blue. It has to be a nebulizer. The dose is 5 ml of 0.1 methylene blue solution or 0.5 ml of 1% injection solution diluted in 4.5 ml of distilled water. And 1 ml of dextrona if possible, or 1 ml of duolin to be added so that the fibrosis also can be reduced. Nebulize and inhale over 3.5 to 4 minutes, first time under supervision of MD, and then you can do it at home. In a severe cases, they used to do twice a day. In a moderate and mild cases, once a day for about 10 days, and subsequently to continue if fibrosis is suspected. This is how he gives. He is modified and the person who cannot afford, he gives nebulizer in his clinic free of charge. This also is available on Amazon. There is a spray which is there. You can recharge the spray. This also works very well. It costs 175 rupees only. This is the site from where you can buy that. This is another vaporizer, which is steam inhaler. This is used in common cold. You can also use the same thing. There are large holdings of advertisement of this company on the highway. Preferably do not use this because this is a vaporizer, but they have advertised other thing, which is a nebulizer on the highway. This is another method where Yorkshire Laser Center has also shown the effect of methylene blue. Safety concerns of methylene blue, whether how safe it is. Safety of methylene blue plus chloroquine combination in treatment of uncomplicated falciparum malaria in a young children in Burkina Faso. Now this is a small place, even we don't know where it is, where they have treated large number of patients, even with the G6PD, and they have shown that it is extremely safe. This is done under the supervision of Germany. They treated 226 children with malaria. The hemodialysis risk in malaria in Heidelberg University Medical College. Methylene blue in malaria is been used widely in Africa, where they have treated even in 6 PD defect also. So in short, an ounce of prevention is worth a pound of cure. This is another paper from Geneva, Switzerland, which I already. Now, understanding the methylene blue concentration, how do you prepare this? 1% of 10 milligram of methylene blue injection is available in 1% solutions in the market. 1% is actually 1 gram per ml of fluid. 1 gram in 100 ml is 1%. 1000 microgram in 100 ml. 1 gram, in all these calculations, you have to dilute this ampule of 10 ml into 90 ml of water. That makes it 0.1%. Dr. Deepak Golwankar has calculated and suggested 2.5 ml of 0.1 methylene blue aqueous solution sublingually daily, once in the morning on an empty stomach. What I do is I take 2.5 ml of methylene blue sublingually, keep it for some time, and then gargle it before going to bed. So whatever the virus which has entered in my mouth the whole day gets treated with methylene blue. You can cut this thing into 2 parts, once in the morning and once in the night. He has treated about 2,000 patients, and myself has treated more than 5,000 patients in Mumbai, where we have distributed the sachet of methylene blue without charging them anything. He has given the name बुरी दवा जिसमें जिस जीव के अंदर कोरोना हो जाए छू मंत्र. Does methylene blue work? Yes. Observation study has been done in 50 families, 300 prime contacts, spouse, blood, close relatives, half non-taker of methylene blue, half were taken of methylene blue. Those who did not take methylene blue, 60% of them came positive in the next 10 days. Those who took methylene blue, 92% have remained negative. Those 8% who got COVID because they were not regular taker of methylene blue, they got only a mild symptoms. My own family, including my in-laws and my cis family, all of them had mild symptoms, and we have treated. They had mild symptoms of COVID-19 because they were taking preventive methylene blue orally. I take it every day at night for last 2 months. Dr. Golwankar has treated 2,000 patients. Myself has treated 5,000 patients. Observational study of these 200 families, almost zero infection rate in these families because they all are strongly advised to take and give methylene blue bottle by Dr. Golwankar. He distributes bottle free of charge. Advice Sanjay Paranjpe He has taken the help of Mr. Sanjay Paranjpe to distribute in, and the other people were. Bhavnagar is fast reaching 0 case target. Its specificity is 99.9%, sensitivity is 76%. Rapid antigen test detects spikes in protein and surface of lipoprotein complex specific to SARS-CoV-19. The patient who had come positive today is given methylene blue sublingually, nebulizer twice a day with UV light also if possible. The swab of rapid test on next day became negative. 135 cases have been reported in this study. You repeat the experiment in your. This is the way the methylene blue bottle looks like. I hope everything is clear now. Am I speaking properly? Hello?
Yes, yes, sir. Yes, sir.
It's going on well, no? Means you are all able to hear, no?
Yes, sir.
Okay. Now, how I can make the methylene blue at home for my families and pets? We are not advocating or soliciting anyone who has faith in me. They can prepare methylene blue themselves. I am just describing it and what I felt and very useful for me and my family. You all are requested to take your own informed decisions yourself. This is how you can prepare it. The 90 ml of water and 10 ml of methylene blue injections. This is at present sometimes in short supply, but anybody who wants it, I can give it. I have few ampoules with me. This is another one which 99.8% powder is there, which is actually used for analytical grade. You can also prepare 500 milligram of pouch and dilute in 500 ml of water. Each bottle will last for about 1.5 months for family of 4. 1 gram of methylene blue or 500 milligram methylene blue in either 1000 ml of water or 500 ml of water. This is how he is preparing. My friend Dr. Kakadia, who is a chief of the one who has done a lot of work as an ophthalmologist in treating the COVID-19 patient in Bhavnagar. It tastes like a jambu and it stains your tongue for few hours like a jambu. It's a pan-varicidal, bactericidal and fungicidal. So no need for any preservative, no need for any buffer or pH compensating solution. It is basic organic nitrobenzene based azothioxane chemical and not really a pharma drug. So it is almost it has got indefinite shelf life. This is the way 2.5 ml. You can either use half the teaspoon or you can use the pediatric dropper. This is also the measurements are available on Amazon. This is how your tongue looks for few hours. This is in the morning and this is in the night. The jambu which we eat, it's almost the same. You can use the dropper. Suppose somebody doesn't like the taste, then he can put this small amount of 2.5 ml of methylene blue in a lime juice and take it orally. This is the way it is been done. You can use the lime juice. The taste and the color also will not be displeasing, not bad as if you take it without lime juice. The another thing which we tried is, because most of the virus, if you see 80 to 90% of the virus is lying in oral and nasal cavity. So I treated my brother for the first time by putting this 0.03% methylene blue specially prepared drops and put it into the nose, and he got symptom relief on the next day. Dr. Kakadia, who has suggested some of the suggestions. One of them is you can put this methylene blue solution and impregnate it into the Sitophilade tablet and take it outside when you are traveling, because traveling with liquid fluid, it can stain your clothes, and sometimes the clothes stain does not disappear. This is another thing where you can put it in chewable tablet of vitamin C, and this is and even you can put it into the Digene or Gelusil tablet also. This is an official drug which is available in United States. A methylene blue tablet is also available in United States. If they are making this drug available in United States, it has to be a very safe. Otherwise, that country will FDA will never allow. The name is AYURVED. This is there is one more country in which methylene blue eye drops are also available. I think it is in Egypt. There are few papers from Tehran University, Iran. Again, same thing which is there from other countries. You see the Halloween days which is there in United States, they make various faces, and methylene blue is used to stain the tongue to scare the other people. This is the way they scare others. And this is officially available in United States. Methylene blue also act as a nootropic full review which is there. If you want anybody, I can get the link so that you can see yourself the effect of methylene blue. The other thing which most of the people are scared about is whether this drug is safe or toxic. In last 140 years of use of methylene blue, not a single patient suffered kidney failure, liver failure, not a single death has occurred. So it is nearly completely absorbed from sublingual and GI tract, and also from the lung tissue. The excretion takes place 97% from the urine without metabolism, and 2% passes from the stool. It has no hepatotoxicity, no renal toxicity. Methylene blue passes out in urine without any chemical change, not hepatotoxic, not nephrotoxic, nor it is carcinogenic. This is the way many companies in India are making methylene blue injections. These are a few of them. Most of them are made from the Bombay-based companies. This is the address. You can buy it from them. You can write this address, or you can go to the website Avalon Pharma at avalonpharma.com. Now, again, last time I told you before in the first few slides, Dr. Anil Patel, who has done a lot of work on treating these COVID-19 patients with pneumonia, antiviral property is more important and potent than anti-inflammatory. Very effective if it's given in first 3-4 days on the onset of symptoms. There are no side effects. There are no side effects if G6PD deficiency is ruled out. So in India, we consider G6PD still a relative contraindication for giving methylene blue. For a late stage patients, continuous IV infusions or frequent nebulizer should be given to treat these patients. We also suggest that if glomerular filtration is less than 30 ml per minute or 1.73 square millimeter to avoid, if the output of the urine is less than 800 ml per day, he advises not to use methylene blue. 1 or 2 milligram per kg body weight is the best dose for IV infusions. IV infusion should be given preferably in 5% dextrose, not in normal saline. If you are giving in normal saline, it should be given over a period of 3 to 4 hours. In severe cases, give slow IV infusions up to 100 milligram per day. IV methylene blue can be safely given up to 5 days. Monitor hemoglobin, reticulo count, and serum bilirubin. The cautions again in IV methylene blue is not to be given in the same day when given in ivos tocilizumab. preferably don't give, because we had one person who died after giving methylene blue and tocilizumab. Methylene blue is the best. Methylene blue's best role is in the early phase of infections, maybe up to moderate stage of infections. After that, it may not work. In severe cases or very severe cases, especially old age, with many morbidities, beneficial effect of methylene blue is limited, especially in poorly controlled diabetes where uh, uh, HbA1c is above 7.5. Methemoglobinemia will be more pronounced and not reversible. Such diabetic patients should be given RBC PAXA volume from healthy donor. This has been found very good and relatively very easy option. This is Surgical Oncology Center from University of Medical Science, Masad, Iran, which has also shown the reduced dye. They use this dye in orthopedic to treat some of the illness. This is used in Indonesia as a routine for treatment of COVID-19. Here you see how the COVID-19 is flowing into the veins under the skin. In open heart surgery, a cardioplegic shock, when the patient is put on a cardiopulmonary machine, where the blood is diverted to the machine and the heart is put at the rest. When you want to, with the help of ice pack, and when you want to reverse the things so that the heart starts functioning, there are sometimes it does not regain its, the heart does not starts it pumping immediately, and that is known as a cardioplegic shock that can be reversed by IV methylene blue. The side effect is bitter taste for 1 hour, blue tongue for 4 hours, greenish sting urine, rarely nausea, rarely diarrhea, mild rise of skin temperature, hot feeling like systemic atropine or steroid, mild rise in about 5 to 10 degree of systolic blood pressure, mild irritation for few hours after nasal inhalation. No any major side effect have been known since 1881. Not a single death has occurred. It is the treatment of anaphylaxis. Advantages, side effect. There are certain observations which myself and Dr. Kakade has seen after taking personally this methylene blue. The sleep requirement is reduced. The mental as well as the physical lethargy, fatigue and tiredness disappears. Pain tolerance as well as the physical endurance increases. Mental higher functions, memory improves significantly. Blood sugar falls by 50 to 70 milligram in diabetic patients. This I am talking of myself. Mood improves so much that we never feel blue or black in the mood. Feeling of innocent bliss, and gives a sort of not seven feeling. It kills the constipation also. This is the way the shining of the teeth occurs. This is before treating the methylene blue, and this is after meeting the teeth. It also cures the caries which develops under the tooth. Aphthous also gets treated with methylene blue. Now, when you get up in the morning, so many times you see this, the whitening of the tongue, which is because of the growth of certain microorganisms. And you have to use the tongue cleaner to remove that thing. But after taking the methylene blue, this completely disappears and you don't need it. There are many patients who have said that their chronic tonsillitis, chronic pharyngitis have disappeared after taking the methylene blue. So regular use of methylene blue will prevent, it is used in preventive medicine also. In my area where I stay, we used to always see 100 to 150 patients of dengue every year. But after starting the methylene blue for last 2 months, 10 patients. Influenza A, hepatitis A, B and C, Nipah, Zika, left line viruses, Japanese encephalitis, urinary tract infections, falciparum and vivax malaria. So if you're taking a methylene blue, So if the mosquito takes your blood, it will not have the malaria parasite in it because most of the malarian parasites are killed. This is again another paper where it shows it kills the malarian parasites in 48 hours. Now, there are certain contraindications of methylene blue. In the first and the second trimester of pregnancy, please avoid it. The third trimester, it can be given safely if the risk to the mother's life is more than the risk-benefit ratio to be considered in favor of mother. Avoid in severe kidney or liver failures. Monoamine oxidase inhibitor, that is those who are taking antipsychotic, please avoid them. G6PD, at least in our country, we are not giving now, can be given in children up from 9 months onwards. Upper age is, there is no bar. Frequent ask of questions. Can a ischemic heart disease or coronary bypass patient take the methylene blue? Yes, it can take. Can a cancer patient take it? Yes. In fact, methylene blue is a part of chemotherapy in many types of cancers. Age 9 months onwards up to the age of 110 years. Chronic renal failures, oral or sublingual, can be taken but preferably avoided. IV to be avoided in glomerular filtration less than 30 ml per minute. So another few papers which suggest the effectivity of the methylene blue. Again, it has got a very good effect on Alzheimer disease. Protective role of methylene blue in Alzheimer disease via mitochondrial and cytochrome oxidase. It delays the progress of Alzheimer disease. And some of the people have recovered their memory by 30 to 40% after taking the methylene blue for a few months. This is excellent nootropic, improved cognitions and recognitions, aid memories. Huntington's disease, Alzheimer's disease, and Parkinson. You can see the amount of improvement that takes place between the right and the left pictures. It is an energy booster. It also helps in rheumatoid arthritis. I have treated 2 patients of rheumatoid arthritis with oral methylene blue, and both of them improved significantly. To my personal experience, we have treated 3 patients with chronic fibrosis of the lungs for last 10 years. They had come for cataract surgery, and I gave them 15 days of methylene blue nebulizer, and they came with the result. They never felt so well in the nebulizer of methylene blue. Methylene blue is traditional mitochondrial targeting antioxidant, showed potent ROS, scavenging efficacy in cultured human skin fibrosis derived from healthy donors. This is again anti-aging potential of methylene blue, and we are very likely to come out with anti-aging ointment for skin. At present time, for using it myself, we have seen about 30 to 40% reversal of aging of my skin. This is the way it is done. You see on one side and the other side methylene blue. This side the methylene blue is applied. This side there is no methylene blue applied. I have seen myself, and at present I am doing for last 10 to 15 days. We'll continue for 2 months to find out the result. This is another one. Anti-aging creams are all skin aging creams are available in the United States. Thank you so much for listening to my lengthy lectures about the methylene blue. Methylene blue is going to change a lot of things as far as the medication is concerned, the antibacterial activity is concerned, the antibiotic is going to change a lot of changes. In fact, some of the herpes simplex and herpes zoster patients have been treated. If you, I can show you the picture on my mobile because I don't have them here. But you will be so surprised that in 3rd or 4th day, all full forehead of a patient got completely cured with methylene. With this, I bring my lecture to an end. I'll show the pictures if I get them and if the chairperson permits me. I can take this.
Sir, thank you very much. Sir, thank you very much. This is a great presentation and a wonderful explanation. Thanks for your speech. Dhanya ma'am, please give vote of thanks.
Yes, I'll just show you the picture if you want. The herpes.
Yes, sir.
Just 1 minute, madam.
Okay, okay.
In fact, in countries, we have started using methylene as a routine. See this patient was not able to walk also, but after taking the methylene blue of inhalation, he came walking for the cataract surgery and went back walking home. Can you see this picture? This is an herpes patient. This is before the treatment, and I will show you the 4th day after the treatment. This is on the 2nd day. This is on the 5th day. Can you see these pictures? Hello? Hello?
हाँ, yes, sir.
Can you see?
ऊपर
थोड़ा ऊपर लीजिए, थोड़ा सा. हाँ.
Now?
Yes, sir. ये हाथ साइड में कीजिए.
Can you see?
हम्म.
This is complete clear. I'll show the before the treatment. Now, this is before. Can you see?
Yes, yes.
Yeah, yeah.
So this is how the methylene blue works for herpes also. You don't need any oral medications in herpes after this. Now I can take the few questions if possible. Otherwise, we bring the end to this webinar. Anybody who wants methylene blue packets, they can come to my clinic and we can give as many as you want. My clinic is opposite Kalyan Jewelers on S. But to be very honest, I'll tell you recently, many hospitals in Mumbai, one of the hospitals which are definitely treating IV methylene blue is Nanavati Hospital. They have given one article in Times of India about 15 days back about how effective the methylene blue has been. If you see yesterday, we had only 20 deaths in Mumbai. So we could bring down with all the medications, not only methylene blue, the other thing also. We could control the COVID-19 in a significant way in India. And we hope that the second wave does not be so strong. And we COVID really able to get wins over. And methylene blue is really working. I'll tell you myself, my family members, my brother, my sister, everybody got affected, but none of them had more than 2 or 3 days of symptoms. None of them have. And if you are treating in first 3 days of the symptoms now, even oral is enough. Nebulizer works the best. My sister has done the COVID score, treated with methylene blue, nebulizer and oral, and in 3 days, her symptoms become perfectly all right. Methylene blue has definite role in treatment of this, the COVID-19. Do we have a solution better than this? Anybody is objecting or anybody is not having an open mind to understand this, do you have a better choice? Do you have better solutions? And what is the harm in giving this? Put it this way. What is the harm? There is no harm. You are not damaging anybody, even the smallest portion. Kidney, liver, nothing. In 130 years, nothing has developed. Why are we so narrow-minded to think, not to think positively about this small, very important and very cheap medicine for all of us? When I can take it for last 2 months, even I would be more worried about my kidney also. And I did my creatinine in last 2 months, it has remained the same. Yes,
how a
anything?
diabetic patient can take this insulin in what doses?
Same doses for everybody is the same, except in the chronic renal failure or when the urine output is less than 750. We don't recommend to use this because it takes a very long time to clear from the kidney. So we don't want to use it. For diabetic patients, the dose is same as non-diabetic patients.
Even chronic diabetic patients can have this?
I myself is a chronic diabetic patient. I am taking it. And my